Welcome to today's episode of Lifestyle Matters, and we're joined once again by Fergal Armstrong. Welcome, Fergal. How are you today?
I'm well, Savina. How are you?
I'm good. So, Fergal, I thought today we might explore a little bit more on our last episode where we talked about stress. Where we left off was that stress in the right doses and right tools to manage it can in fact be a great tool to have to motivate us to be more productive in our lives. But not many of us are actually equipped with those tools. And sometimes, I guess, when stress gets quite, if there's a huge amount of stress in our lives, we end up feeling overwhelmed and we just, sort of like a fish out of water, not sure what to do, how to manage it, and how to cope. And I've been in that situation. I'm not sure about you, but I have been there. And I thought it would be good to actually talk about some ways on how we could better manage our stress so that we can function better.
Yeah, you're absolutely right, Savina. I mean, we know that a third of people per day actually experience levels of stress that impede their performance. And as you say, this goes back to the Yerkes-Dodson curve, where people have too much stress and therefore are distressed and are impaired. And so a slight reduction in the levels of stress will actually get them back to peak performance. So the question then becomes, how do we actually reduce the impact of stress in our lives? And I divide the interventions into behavioral interventions and cognitive interventions. If we think about behavioral interventions, we have to think about physical exercise. We have to think about adequate sleep. We have to think about Tai Chi. We have to think about yoga. We have to think about mindful eating. These are just some of the behavioral activities that we can actually do regularly that will, by the mere physical act of performing these activities, will reduce our stress. And we can go into those later on. The cognitive interventions I think about in terms of primarily reducing stress and then also specific interventions for relaxation therapy. So the interventions that we can use to reduce stress on a cognitive level include things like meditation, mindfulness, contemplation, and specific interventions that we can use to reduce or improve our relaxation include things like gratitude, writing gratitude letters. That can improve our psychology, which means we can cope better with stress. Making an inventory of our strengths, acts of kindness, acts of spirituality.
Self-love is another thing, isn't it?
Self-love.
Yeah.
Having fun and noting and levering our past successes. These are all things which can actually improve our positive psychology and can improve on a cognitive level our ability to relax, and then can also improve our ability to manage stress. So there's another group of interventions which reduce the effect of stress on our bodies. And that includes things like grounding, autogenic training, square breathing, and also progressive muscle relaxation. And I think we should really spend some time talking about each of these interventions in turn. But overall, that's the panoramic view that I have of the interventions that we can use to deal with stress and therefore move ourselves away from the high end of stress where our performance is impeded to moderate levels of stress, eustress where our performance is actually at its peak.
And I think it's an important point you make there, because sometimes it varies. Firstly, different people will have different ways they'll find, different methods they'll find to help reduce stress levels effectively. That's one aspect. Yeah. And the other thing is also the situations we might be in. So sometimes in one situation A, we might find doing more, for example, progressive muscle relaxation more useful. And in a situation B, we might find, breathing exercises more useful. And so it's a good, it's good to know those broad ways of trying to reduce our stress and not just focusing on one. So it's a very good point that you've made. There's many ways to manage stress, essentially. Yeah.
And that list that I've given you, I mean, they are simply the tip of the iceberg and how we can actually improve our positive psychology, relax ourselves and manage our stress. But it's a good list to start off with, isn't it?
Yeah. And I'll just start off by talking about self-love and self-care, because I don't think we do enough of that. there are very few people that I have met who actually loves themselves. And when you don't love yourself, you don't actually, provide enough gratitude for yourself for what you do, and you don't appreciate what you've done. And you end up putting more pressure on yourself and more stress on yourself. And that just makes everything even more overwhelming. So I think the first management is actually coming from deep within yourself, learning how to be comfortable in your own skin and caring and loving what you are. And that your external factors would be a lot easier to manage.
And I think, if I could reflect on that, there are certain groups of people that really do need to do that. And those are the individuals who are the type A high achievers who are always driven to do more. And those who are perfectionistic in their outlook and possibly have obsessive compulsive personality traits.
You can get too stuck into the finer details and lose sense of the bigger picture and all that.
Lose sense of the bigger picture. So those kinds of people, they need to realize that if something is worthwhile doing, it's worth doing badly. And they need to be kind to themselves and to accept that they're not superhuman.
Yeah. I think that's a very important point for lots of people.
I suppose really, if I could sum it up, it's anyone who's driven by the fear of failure.
I think, fear of failure is one thing. Very, very, I guess it's a very important thing to mention because, what I think there is sort of a thing where if you are afraid of your past, you are more, you're more likely to develop depression. And if you're more afraid of your present time, you are more likely to experience stress. And that all comes down from fear in the end, isn't it?
Yeah, absolutely.
Yeah. So shall we break it down so we talked about, should we start with the physical activities and how that might help to manage our stress levels?
Yeah, so in terms of physical activities, I think of Tai Chi, yoga. Those are well, first of all, any exercise. So going for a walk. Or any sport, any sport that takes your mind, distracts you away from the problems that you're facing, and then also increases your heart rate, gets you breaking a sweat, releases endorphins, anything. But then Tai Chi and yoga are also well documented to actually reduce stress. I mean, we know that people who do yoga at least 3 times a week for I think over a year, I think there was evidence that they actually have found on brain scans that their prefrontal cortices are actually thicker. And they've got greater connectivity between various brain structures, which allows them to deal with stress and also deal with pain. So, it's not just mumbo jumbo. It's not easy.
They've actually seen it in scientific evidence in imaging to see how this prefrontal cortex is light up after doing prolonged activities of yoga and meditation and things like that. So, you're quite right. And I guess also they've also found things like, if you adhere to regular physical exercise, it actually helps reduce your state of anxiety and helps reduce your stress levels too.
It also helps you reduce depression. I mean, there's actually a dose-dependent relationship between physical activity and an improvement in depression. If you exercise where you burn 17.5 kilocalories per kilogram per day, you increase your likelihood of treating depression. Now, how do you get to that? I mean, that's a very mathematical way of describing. Basically, if you adhere to the current recommended activity guidelines in Australia, you have a good chance of actually reducing your depression. And so those activity guidelines actually say 2.5 hours of moderate activity.
So you're referring more to aerobic sort of activity.
In
line with this. Yeah.
Well, no, 150 minutes, not 2.5 hours, 1.5 hours.
150 minutes, yes. Yeah. Does that also translate to if you do 75 minutes of vigorous activity a week, would you still achieve the same benefit?
I reckon so, because remember the mathematical formula is 17.5 kilocalories per kilogram per day. So if you do vigorous activity, you're burning more kilocalories per kilogram.
Yeah. Well, I can tell you firsthand, when I've had a stressful day at work, I come back, if I go to the gym, I actually feel a lot better. It's like you feel like a load off you. It just makes you feel a lot lighter. Yeah. So, it's all not just, I guess, psychological. There must be something else happening in the brain chemical changes.
There must be something else.
Yeah. So I guess the other thing is, we talked about, we didn't mention actually diet at the start of it.
Well,
How,
I suppose there's a number of things to say about diet, but the better evidence for diet is more for depression. But if we're looking at actual stress, it's slightly different. But we know that, for instance, if you trans fats increases your risk of depression. If you replace trans fats with MUFAs and PUFAs, it reduces your risk of depression. And we know that a healthy predominantly plant-based food diet will actually improve depression. There's very good evidence for that. But if we slightly veer away from that, we look into kind of substances, we know that there's a bidirectional relationship between alcohol and depression and also alcohol and anxiety. We also know that actually, a lot of people drink caffeine because of mental health issues. But we know that actually caffeine is protective against depression, but it actually worsens stress and anxiety. So I think it's really important to emphasize that if you are feeling stressed and anxious, you really do need to stop the stimulants. I mean, I'm sure you do as well. I see a lot of people in my practice who present with insomnia and they say, I want something to sleep, or I can't sleep, therefore I feel tired in the day, therefore I take stimulants, i.e. caffeine. And to actually say to people, you must completely abstain from all forms of caffeine and anything like caffeine. So you've got to abstain from chocolate, coffee, tea. And in fact, really, the only thing you can drink really are herbal teas or clear water. That sometimes is a very difficult message to get across to patients because they are so, pardon the word, but they're so addicted to their morning coffee. But it really does make a significant difference. If you can get rid of the caffeine, your anxiety will reduce.
I'll be guilty of that.
Yeah, but I would caution people watching this to make sure they understand that actually caffeine is protective against depression. So if you're dealing with depression, I don't necessarily advise cessation of caffeine. If you're dealing with anxiety disorders or PTSD or insomnia or nightmare disorders, absolutely stop all the caffeine, stop all of the other stimulants.
Yeah. And, it's one of those things that we ask about when someone comes with palpitations, when they feel like their heart is beating, really fast or having some sort of like a panic attack, what the caffeine intake is. Yeah. And there's a reason behind it because it stimulates, I guess, our sympathetic nervous system, and then it increases our heart rate, increases our metabolic rate, and so on. And you would feel more in a more higher state of anxiety.
The other issue is, of course, if we're talking about, caffeine and alcohol, we also need to think about tobacco smoking and nicotine. And we know that young people who smoke are at risk of depression, and people with depression are at risk of smoking. And also we know that actually people say to me, oh, look, when I'm feeling stressed, I actually take a cigarette. Well, actually, in the longer term, smoking actually increases anxiety. So whilst it may act as a short-term crutch, it really does in the long term. It really does increase anxiety levels. So if you're feeling stressed in the longer term, you do need to stop for the fags. So telling people to stop the fags, stop the booze, stop the caffeine, eat more plants, do more exercise, start doing yoga and Tai Chi. It's easy to say, but it is quite a hard sell, isn't it? But these are all very valid behavioral interventions for stress management and anxiety management.
And as you pointed out, it's hard because, those are the things that we tend to reach for when we are stressed, because our body craves for it, our mind craves for it, and we reach for it. But then in the actual fact, it's actually causing more long-term harm. It might be providing short-term relief, but we don't think about the long-term harm. And it's a very hard message to get across. So my advice usually, I'm not sure how you approach this, is I usually sort of tread the water slowly and, probably start with one substance that an individual
I advise caffeine cessation first. For me, it's caffeine. Stop the
because and so that when you do your smoking and everything, it's a lot easier, as we have discussed previously in the episodes. That's a good point. And it's going to be a bit easier, I think, to give up caffeine than smoking or alcohol or recreational drugs for some.
I personally drink caffeine-free coffee. So I go to, coffee shops and say, can I have a decaf double shot latte? And they look at me and laugh. That's what I like.
I have noticed that, Fergal, but yeah. What are your thoughts about vitamin B12? So even today, I had a patient talk to me about starting vitamin B mega complex, and they found their anxiety levels better. What do you have any advice when someone talks to you about this or asks for your advice?
Look, as a general rule, I don't recommend vitamin supplements unless there's an identified vitamin deficiency. Look, there are professionals who advocate high doses of various types of vitamins for various ailments, but I'm not an expert in that kind of medicine. I don't know enough about it to either say yay or nay, but I don't recommend supplementation unless I've got a proven deficiency. Now,
Yeah.
that's not to say, in terms of B12, that's not to say that all B12 has got to be pernicious anemia. There are various other causes of relative deficiency of B12, certainly associated with atrophic gastritis in the elderly, or the use of proton pump inhibitors in people with gastritis or reflux disease.
That would be like Nexium and Somac and
Nexium
the common ones.
and things like
that.
Yeah.
Yes, and I agree with you there. I think unless someone's for example, a vegetarian or a vegan, then sometimes I might choose to, I guess I take it a step further. If they're in that situation, then I might choose to say, if you wanted to try something natural, we could try this and see how we go for a few months. But my stance would be quite similar to yours, where I would say, let's try to get it from our foods, because really, if you eat the right foods, like your whole grains, your vegetables, your whole food plant-based diet, you are going to get those vitamins, essentially, by eating lots of beans and dairy and things like that too. So, yeah. Okay. So we talked about the exercise, how we could manage, how stress can help help us manage our stress levels, how diet potentially can have a role, or including substance use. Well, let's talk about the cognitive therapy, cognitive aspect of stress management.
Yeah.
What's your take on that one?
There are two main therapies that have got a significant, vast evidence base for the management of stress and anxiety and depression. That is one is mindfulness. The other one is cognitive behavioral therapy. So if we look at mindfulness first, it was invented by John Kabat-Zinn in the 60s, I think.
Yep.
And it's fundamentally the process of developing a beginner's curiosity, the curious mind, the observing curious mind, where you actually are aware of your stress and you're accepting of the stress, you're watching it, you're monitoring it. And, you know that it's going to pass over you. All things will pass. It also involves a certain amount of, constant mindful activities whereby you are focusing your mind on what you're doing in the here and now. So there is an idea of living in the present, living in the here and now. So, you can be mindful when you're washing the dishes. You can be mindful when you're having dinner. You can be mindful when you're talking to your spouse. And so that's one of the things that I'm very guilty of. My wife frequently tells me that I'm not paying attention to her. And I say to her, well, how do you know? I mean, she's right, because I'm daydreaming. But what it's taught me is it's really obvious to people around you if you're not actually giving them your full mindful attention. So this focusing of your awareness and focusing of your attention actually has been proven to provide positive benefits in the long term with regards to mental health, including stress, and also with regards to various other pain conditions as well.
I think it's hard, though, isn't it? In this modern world, though, we've got so many responsibilities. We're all juggling with different things.
Remember, we cannot multitask. Only, I think, 2 or 3%
unless you're
of the
a woman.
population.
I'm kidding.
Far be it for me to say, right? But this includes women. Only 2 or 3% of the population can genuinely multitask. Everyone else has only got the ability to do one thing at one time. And so if you're having to shift your focus from one thing to another, to a third, to a fourth, you are experiencing what is known as attentional blinks. And so you're losing productivity and you're not able to be as productive. And when you're stressed, we then tend to be more scattered in our focus. So the whole idea with mindfulness and meditation, for that matter, is that we actually learn to develop a laser light intense focus and to put that focus on whatever it is we're doing at that time. And so we end up being more productive and we end up developing techniques to reduce our stress. So actually in this modern day and age, we do need to actually be more focused rather than less focused. The scatterbrain multitasking approach is actually contributing to our stress.
But I'd have people ask me then, how do you manage all your, list of A to Z, just focusing on one task at a single time and at a given time? And I guess my advice would be to prioritize your tasks. Have a
Well,
list and say what you're going to do, what's priority, what do you need to get done today, and then sort of focus that time for each
absolutely.
task.
So I have a to-do list, as you say, and it's a ever expanding to-do list. But once it's on my to-do list, I can relax. The other thing I do is the Pomodoro method, which is whereby you have this timer that breaks your time, your productive time, into 15 to 20 minute chunks. And so every 15 minutes, you do nothing but that task, and then you have a 5-10 minute break. You can do all of the other stuff that you need to do. You might even go for a walk. You might have a cup of tea. You might have a chat. You might put the washing in the laundry. And then you go back for another 15 minutes to 20 minutes and you focus on your task. And you do that 3 or 4 times. And it's actually amazing how much you get achieved in that productive time when you're doing nothing but productive tasks.
I can vouch for that, actually.
Yeah.
So my husband, as you know, he's doing his PhD, and they've got these Pomodoro workshops where the PhD students sit down, work on the task for X amount of time, have a break, and then they continue doing that. And he has found that productivity does increase when he actually joins those workshops. So,
Yeah.
and that's because you're focusing all your mind on just one task at that given time, and that's all
Yeah.
you've got for that. So it's that pressure of time, I guess.
Yeah, yeah. So we all have the same amount of time in the day. No one's got more time than anyone else. And time is, I think, one of our most precious commodity. We're all mortal beings. So in that regard, there is nothing more precious than our time. So the question is, how do we use it most productively? So there's also the issue about, the parable of the teacup. The parable of the buckets. So, a man goes to another man and says, fill this bucket with rocks. And he fills it up with rocks. And he says, is this full? He says, okay, well, look at this pile of stones. Can you get any stones into it? And so, of course, you can get a few stones in. He jiggles it around. And is it full now? He said, yes. Well, look at this pile of sand. Can you get some sand into it? And the guy puts a couple of buckets or cups of sand into the bucket, shakes it down, and it fills up with sand. And then the man asks the second man, well, is it full now? He says, yes, absolutely full. He says, here's 2 cups of coffee, pour it in. So the moral of the story is, if you use your available time productively and effectively, and you use the time that you would not think of as productive time to do productive tasks, if you do that, you always have time for a cup of coffee with a friend. And so an example of that is, I listen to podcasts in the car. I know you listen to podcasts in the car. Mm. And, when I'm standing at a bus stop, I'll look at my sequence repetition software, my Anki program. So these are things that I do all day that allow me to actually be more productive in time that is not necessarily traditionally productive time.
Yeah. Yeah. So it's using that sort of dead time to be more productive.
Yeah. Exactly. Yeah. Turn dead time into productive time.
Yeah. So those are really great tools that we can use to help reduce our stress levels and to function better in our lives. But there are many other ways to help improve this. Some of it includes resiliency and CBT, which we would discuss further in our next episode, given that we're running out of time today. So thank you so much for your time, Fergal, today. That was a great chat. I look forward to seeing you next time.